Now, having a severe emergency happen at home or out and about can be really stressful for parents. I want to chat a little bit about what you can do to be prepared and what you can do in that moment. The best thing to manage an emergency is to be prepared. So for me, that means things like having the numbers accessible either on your phone or printed out on your fridge at home so that you know who to call for help in a hurry. So things like the 000 emergency service, the poisons hotline, your local GP office, nurse hotlines, or your local emergency department. I'd always check that you've got ambulance cover, or at least know where your closest emergency department is as well. This is particularly important if you're travelling around. And I'd also have some reliable sources on your phone or on your laptops ready to go if you need to look up some information without having to go into hospital. So things like the Raising Children Network website, the Royal Children's Hospital Kids Health info sheets, Maternal Child Health Nurse website. These sources are reputable, evidence-based, and really good for parents to have a quick read of some of the common conditions that you might need some extra support with. Now, parents are also welcome to get specific training on what to do if your child has a collapse at home. So for example, if they need CPR. Parents who have had previous bad experiences with either losing children or having severely bad outcomes, they can benefit from this sort of training. If your child has a significant medical condition, that can also be quite helpful. Or if you just want your own reassurance and training, having some CPR training can help. The general principles though, if your child suddenly collapses and you're not sure what to do, is to make sure that the area around them is clear. Often we prefer to place them on their side, particularly if they're having a seizure, and you call the ambulance as soon as you can. While you're waiting for the ambulance, they will often give you support on what you can do, but things like keeping an eye on what exactly is happening with your child, if they're making movements, what their colour is, if they're breathing, information like that can be very helpful. Now, of course, it's impossible to not panic when your child has collapsed like that. But the main thing is to call for help as early as you can so that we can do the best to help your child.